The snow came sideways that night. Clara Whitmore stood in a ranch kitchen, her hands inside the open abdomen of a woman she had met 9 minutes ago. Behind her, the richest rancher in 100 miles was on his knees praying. The same man who had spent 6 months trying to destroy her. 8 months ago, she had never held a scalpel. Now she was the only one who could save this woman's life. But to understand how a 21-year-old mail-order bride ended up here, we need to go back. The snow came sideways that night, not falling so much as attacking, and Clara Whitmore stood in a ranch kitchen she had never been inside before, her hands buried in the open abdomen of a woman she had met exactly 9 minutes ago. The lamp on the table flickered. Wind slammed against the windows hard enough to rattle the glass in its frame. Somewhere behind her, a man was praying. Not the quiet kind of praying that people do in churches. The raw kind. The kind that sounds like an animal caught in a trap. Henry Dawson, the richest rancher in 100 miles. The man who had spent the last 6 months trying to destroy everything Clara had built. He was on his knees now, hands clasped so tight the knuckles had gone white, whispering his wife's name over and over like a spell that might keep her alive. Clara did not look at him. She could not afford to look at him. She could not afford to look at anything except the body on the table and the baby inside it that was dying by the minute. Nathaniel Vance stood behind her. For the first time since she had known him, he was not the one holding the scalpel. His hands hung at his sides, steady as always, but not steady enough. 14 hours of surgery earlier that day had taken something out of those hands, something that might come back tomorrow, but was not here tonight. So the scalpel was in Clara's hands. 8 months ago, she had never held one. 6 months ago, she was still a virgin. 3 months ago, half the town wanted her gone. And now she was cutting open a woman's belly on a kitchen table while a blizzard tried to tear the roof off the world. Vance's voice came from behind her, quiet and precise, the way it always was. One word. Cut. Clara, cut. But that is the end of this story, or close to it. To understand how a 21-year-old mail-order bride from St. Louis ended up with a scalpel in her hand and blood on her sleeves in the middle of a Wyoming blizzard, we need to go back. 8 months. To the day the letter arrived. Before we continue, comment below where in the world you are watching from, and please click like and subscribe. The letter came on a Tuesday morning in March of 1873, delivered by a postman who did not bother knocking because the front door of the boarding house on Mulberry Street was never locked. Clara found it on the hallway table between a stack of unpaid bills and a week-old newspaper. Her hands still damp from the carbolic soap she used after every shift at Sisters of Mercy Hospital. She had just finished 16 hours on her feet, 16 hours of holding retractors and threading sutures and mopping blood off the operating floor, while Dr. Hamilton Greaves removed a gangrenous leg from a factory worker who had waited 3 days too long to seek help. Greaves had let her hold the bone saw. First time. She had cut clean and fast and straight, and when it was done, Greaves had looked at her over the top of his spectacles and said 4 words that were both the best compliment and the cruelest thing anyone had ever told her. Good hands. Shame about the skirt. That was the ceiling. That was as high as a woman could rise inside the walls of Sisters of Mercy Hospital in St. Louis, Missouri, in the year of our Lord, 1873. You could be brilliant. You could be fast. You could have steadier hands than half the surgeons on staff. But if you wore a skirt, you held the retractor. You did not hold the knife. Clara picked up the letter. It was not what she expected. She had been expecting the eviction notice, and that was there too, tucked beneath the letter in an envelope marked "Final Warning" in red ink. 2 months behind on rent. 7 days to pay or vacate. She set that one aside. She had read enough eviction notices in her life to know what they said. The other letter was different. It was written on heavy paper in handwriting that was sharp and angular, the kind of penmanship that belonged to someone who had been trained to write quickly under bad conditions. Someone who had learned to form letters in field hospitals or on the backs of supply wagons where neatness mattered less than speed. It read, Dr. Nathaniel Vance, physician and surgeon, Redemption, Wyoming territory. Widower, age 44. Seeking wife with medical knowledge for life and work on the frontier. Room board and competitive salary provided. I need someone willing to learn what is not in the textbooks. Clara read that last line 3 times. She read it standing in the hallway with her damp hands and her aching feet and the smell of carbolic still burning in her nostrils, and something shifted inside her chest. Not hope exactly, something sharper than hope, something closer to recognition. She did not believe in love through letters. She had watched her mother believe in love, and it had killed her slowly the way tuberculosis kills, one cough at a time, one bloody handkerchief at a time, until there was nothing left to cough up, and the believing and the dying became the same thing. Clara had held her mother through the last of it 6 months ago, in a room that smelled of camphor and sweat. She had washed her mother's body afterward because there was no money for the undertaker. She had sewn the burial gown herself because there was no money for that either. Her father, Reverend James Whitmore, had died 2 years before that. Stroke on the pulpit mid-sermon, face down on the open Bible. He had been a Baptist minister of the old school, the kind who believed that suffering was instructive and pleasure was suspicious, and women were meant to be quiet in all things. Clara had loved him. She had also spent her entire childhood being quiet because he required it, and now that he was dead, she sometimes caught herself speaking louder than necessary just because she could. She was 21 years old. She had no family. She had no money. She had $4.30 in a tin box under her bed and a nursing diploma that entitled her to hold other people's instruments while they did the work she was capable of doing herself. And she had this letter. She wrote her reply before she changed out of her work clothes, before she ate, before she slept. She wrote it in the same sharp, efficient hand she used for patient charts, and she did not waste words. Dear Dr. Vance, I accept. I am a trained surgical nurse with 2 years general nursing and 1 year surgical assistance at Sisters of Mercy Hospital, St. Louis. I am competent, reliable, and willing to learn. I will be on the next available train west. Yours sincerely, Clara Whitmore. She did not mention that she was a virgin who had never been kissed. She did not mention that her entire knowledge of the male body came from anatomy textbooks and the occasional cadaver displayed in a lecture hall. She did not mention that the phrase willing to learn had made her pulse quicken in a way she did not entirely understand. What she also did not know, what she would not learn for a long time, was that the letter had not been written by one man. It had been written by three. They had discussed it around the kitchen table for 2 hours before Vance picked up the pen, and the line about learning what is not in the textbooks had been suggested by the youngest of them, a man named August, who rarely spoke, but who, when he did, said exactly the thing that mattered most. But that comes later. 3 weeks on the Union Pacific Railroad. Clara watched the country change through the window of a second-class car, the green hills of Missouri flattening into the brown expanse of the Great Plains, the sky widening until it seemed to take up more space than the earth beneath it. She carried one leather trunk, her nursing bag, and a copy of Gray's Anatomy that Dr. Greaves had pressed into her hands on her last day at the hospital. In Cheyenne, she transferred to a northbound stagecoach. The road was not really a road. It was a suggestion made in dirt winding through country that looked like the surface of some distant and inhospitable planet. Red rock, pale grass, sky so empty it made her chest feel tight in a way she could not name. Not fear, something more like vertigo, as though the sheer amount of open space was pulling her out of herself. The woman sitting across from her in the stagecoach was named Martha Pruitt, 50 years old, wife of the Reverend Thomas Pruitt of the Redemption Community Church. She had a kind face and sharp eyes, the kind of woman who knew everything that happened in a small town and kept most of it to herself. Martha asked where Clara was headed. Clara told her. Redemption, marrying Dr. Vance. Martha went quiet for a long time. Not uncomfortable quiet, thinking quiet, the kind of quiet that meant she was choosing her words with unusual care. Then she said 3 men live in that house, no wives, no families, best doctors inside 100 miles so nobody says anything loud. But in a small town, people always talk. They just talk soft. Clara asked what she meant by that. Martha looked out the window at the passing landscape, the red rock and the pale grass and the enormous empty sky. I hope you know what you are walking into, she said. Then she changed the subject and did not bring it up again. But she had said something else, almost as an afterthought, as the stagecoach rattled over a dry creek bed. Henry Dawson, she said, biggest ranch in the territory. He has written to the governor twice about the moral situation at Vance Medical. Third time, the governor will have to act. Clara filed that away. 2 letters to the governor. A third would force action. She did not know who Henry Dawson was or what moral situation he was referring to, but she understood deadlines. She understood that time was not on someone's side, and she was fairly certain that someone included her. Remember the name Tommy Dawson? It will matter. The town of Redemption appeared on the fourth day of travel, rising out of the flatland like something assembled hastily and without much confidence in its own permanence. A main street of packed dirt, false front buildings painted in shades of gray and sun-faded blue, a livery stable, a general store, a saloon with a hand-painted sign that read the Brass Spur in letters that had once been gold. And at the far end of the street, set slightly back from the rest, a two-story structure built of whitewashed wood with a covered porch and a sign that said simply Vance Medical in black block letters. Clara stepped down from the stagecoach with her trunk and her nursing bag and walked the length of Main Street in the failing light of late afternoon. Her boots made small clouds of dust with each step. Men on the boardwalk stopped their conversations to watch her pass. Not hostile, just attentive in the way that people in small towns are attentive to anything new. Anything that might change the shape of the world they have carefully constructed. She climbed the steps to the porch of Vance Medical and knocked twice. The door opened, and the man standing in the doorway was not what she had been expecting. Nathaniel Vance was 44 years old, though he carried those years in a way that made him seem both older and younger depending on the light. Tall, lean in the manner of men who forget to eat when they are working, dark hair going gray at the temples. A face that was handsome in an austere, unfinished sort of way, as though someone had started carving it from granite and then lost interest halfway through. Sharp jaw, deep-set eyes the color of creek water in winter. A mouth that looked like it had once known how to smile and had since forgotten. He wore a white shirt with the sleeves rolled to the elbows and a leather apron stained with what Clara recognized immediately as blood that had been scrubbed at but not fully removed. His hands were clean, his fingernails were trimmed short. There was a small scar running along the edge of his left thumb, the kind you get from a blade that slips when you are tired. He looked at her for 3 full seconds without speaking. Those 3 seconds felt longer than most conversations Clara had ever had. She could feel him assessing her the way she had watched him assess a patient later, systematically, efficiently cataloging every visible detail and filing it for future reference. Then he said, "Miss Whitmore, I presume." His voice was quiet, precise, the kind of voice that did not need to raise itself to be heard, the kind of voice that made you lean in slightly, not because it was so, but because every word carried exactly the weight it was intended to carry, and no more. Clara nodded. "Dr. Vance, you are early." The letter said Friday's coach. "I found an earlier connection through Laramie." He stepped back from the doorway. "Come in." The interior of Vance Medical was larger than it appeared from the street. The front room served as both waiting area and consultation space, a long wooden bench against one wall, a desk positioned near the window to catch the afternoon light. Beyond that, through an open doorway, a second room held an examination table, glass-fronted cabinets filled with instruments and bottles, and a cast-iron stove radiating heat into the cool spring air. The smell was familiar: carbolic, iodine, laundered linen, and beneath all of that, the faint copper edge of blood. Clara set her bag down by the desk. Vance closed the door behind her and gestured toward the examination room. "I am in the middle of something. If you would like to observe, you are welcome to. If you prefer to settle in, first, your room is upstairs, second door on the left. I will observe." He nodded once as though this was the answer he had expected and walked into the examination room. Clara followed. The patient on the table was a man in his 30s, conscious, but sweating, his shirt removed and his left shoulder wrapped in blood-stained bandaging that someone had applied in haste and without much skill. A ranch hand by the look of him. Sunburned, calloused hands, the kind of man who made his living with his body and understood that his body was also his primary liability. Standing beside the table holding a metal basin was a second man. Clara stopped in the doorway. He was younger than Vance, perhaps 30, blonde hair, pale eyes broad through the shoulders in the way of men who had grown up doing physical labor and had never quite lost the build that came with it. He wore dark trousers and a vest over a collarless shirt, his sleeves rolled back. There was blood on his hands, not his own, old scars across his knuckles. He looked up when Clara entered, and for a moment that lasted exactly 1 heartbeat too long, no one spoke. Then Vance said without turning from the patient, "Miss Whitmore, this is Dr. Elias Roth. Elias, this is Miss Clara Whitmore, the surgical nurse I telegrammed about. She will be assisting us." Us. Clara's mind caught on the word like a splinter. The letter had mentioned only Vance. No partner, no us. Roth set the basin down on the side table and extended his right hand. Miss Whitmore. His grip was firm. His palm was warm. There were old scars across his knuckles that she could feel when their hands met ridges of healed tissue that told a story she did not yet know how to read. Dr. Roth, Clara said, "Elias is fine." Vance glanced over his shoulder. "If you are finished with the introductions, I need that basin. The wound is deeper than I thought." Roth picked up the basin and moved back to the table. Clara stepped closer, positioning herself on the opposite side so that she could see what Vance was doing. The shoulder wound was a laceration long and ragged, the kind that came from barbed wire or a fence post, or some other piece of agricultural equipment that had no interest in clean edges. The bleeding had mostly stopped, but the tissue around it was inflamed and beginning to show the early signs of infection. Vance worked quickly and without unnecessary commentary. His hands moved with the kind of economy that came from years of practice, cleaning the wound, debriding the damaged tissue, suturing in layers. Roth assisted without being asked, handing instruments, adjusting the lamp, anticipating what would be needed next before Vance had to ask for it. Two people working together in a confined space who had developed a shorthand that was half anticipation and half trust. And then Clara saw the third man. She had not heard him enter. He had simply appeared the way some people do, moving so quietly that the air around them does not register the disturbance. He was the youngest of the three, mid-20s perhaps, dark-skinned, black hair worn long enough to touch his collar. He wore a white shirt and dark trousers and a leather tool belt that held what looked like a collection of small metal instruments, each one fitted into its own loop. He did not speak. He simply stood there, watching his arms crossed over his chest, his expression as unreadable as a closed book, in a language Clara did not speak. Vance glanced up. "August. Good timing. Prepare a carbolic dressing and check the laudanum supply. We are running low." The third man nodded and moved toward the cabinets without a word. "Upon." Clara said, "How many doctors are practicing here?" Vance tied off the final suture and stepped back from the table. "Three," he said, "as of 6 months ago. Myself, Elias, and August Morrow. August trained in Paris and New Orleans. He specializes in pharmaceutical preparation and wound care. 3 doctors in a town of less than 800 people." Clara tried to reconcile this information with everything she had believed about frontier medicine, about the scarcity of trained professionals west of the Mississippi, about the isolation and the improvisation and the inevitable compromises that came with practicing medicine in a place where the nearest hospital was 3 days' ride away. She could not. Vance wiped his hands on a clean towel and looked at her directly for the first time since she had entered the examination room. "You are wondering why 3 physicians would choose to work in a town this small." It was not a question. Clara said yes. "The short answer is that we are not here for the town. We are here for the work. Redemption sits at the intersection of 3 cattle trails, 2 mining routes, and the Northern Rail Line. Every man who gets injured within 100 miles ends up here eventually. We see more trauma cases in a month than most city hospitals see in a year." He paused, and in the pause, Clara heard something she would come to recognize as the particular silence that preceded one of Vance's most important statements. "If you want to learn surgery, Miss Whitmore, this is where you learn it." At that exact moment, the front door of Vance Medical slammed open. 2 cowboys half carried, half dragged a third man between them, his face the color of candle wax, his shirt soaked through with blood that was spreading too fast to be anything minor. One of them was shouting, "Horse fell on him." Horse fell and then stepped on his belly. We could see something moving under the skin. Vance was already moving. His expression did not change. His voice did not rise. He looked at the man for exactly 2 seconds the way a mathematician looks at an equation and said, "Internal hemorrhage. Possible ruptured spleen. Surgical suite. Now." What happened next was something Clara would remember for the rest of her life. 3 men who had been standing in separate parts of the room converged into a single unit. Vance issued orders in short, precise phrases. Roth cleared the examination table and began laying out instruments with the speed and accuracy of a man who could do it in his sleep. August appeared from the cabinet area carrying a glass bottle of ether and a mask already measuring dosage in his head. They moved around each other without collision, without hesitation, without a single wasted step. It was not coordination. It was something deeper than coordination. It was the kind of synchronized movement that Clara had only ever seen in surgical teams that had been together for decades, not 2.5 years. Clara stood in the doorway. She did not know what she was supposed to do. She had not been assigned a role. She had not been told where to stand or what to touch or whether she should touch anything at all. Vance looked back at her. One glance. 1 second. "Are you standing there or are you coming in?" Clara came in. She assisted for 3 hours, handing instruments before they were asked for because she watched what Vance was doing and anticipated what he would need. Holding retractors steady when Roth needed both hands free. Mopping blood from the operative field so that Vance could see what he was cutting. She did not speak unless spoken to. She did not hesitate. She did not flinch when the ruptured spleen released a gush of blood that soaked through her sleeves to the elbow. The patient lived. When it was over, when the man was sutured and bandaged and sleeping on the examination table with his color slowly returning, Clara stood at the basin in the back room and washed her hands. They were shaking, not from fear, from the adrenaline that had kept them steady for 3 hours and was now releasing its grip all at once. She did not hear August come in. She never heard August come in. He simply appeared beside her, the way he always did, as though he had been there all along, and she had only just noticed. He set a cup of herbal tea on the edge of the basin. Did not hand it to her, did not place it in her hands, set it down within reach and stepped back. "Drink," he said. "It helps with the shaking." Then he left without another word. Clara drank. Her hand stopped shaking. She looked down at the cup, a simple tin thing chipped at the rim, filled with something that tasted of chamomile, and something else she could not identify, something earthy and slightly bitter. And she thought, "This is the first time a man has given me something without asking for anything in return." That thought stayed with her longer than it should have. Dinner that night was in the large kitchen on the ground floor, accessed through a door at the back of the examination room. The table was long and heavy, built to seat 8 or 10, though tonight there were only 4. Vance at the head, Roth on his right, August on his left, Clara across from August. The meal was simple: roast beef, potatoes, bread that had been baked that morning, a pot of strong black coffee. No one spoke for the first 10 minutes. The silence was not uncomfortable. It was functional. These men ate the way they worked, with focus and efficiency. And when the plates were mostly empty, Vance set down his fork and looked at Clara. "Tell me about your training," she told him. "Sisters of Mercy, Dr. Greaves, 2 years general nursing, 1 year surgical assistance, abdominal surgery and traumatic injuries." "Greaves is a good surgeon," Vance said. Clara said, "He was an excellent teacher." Then the real question, the one she had been expecting, the one she had rehearsed answers for during the long train ride west. "Why did you leave?" Clara hesitated. She could feel all 3 of them watching her, Vance with his direct assessing gaze, Roth with an expression of casual interest that did not quite hide the attention beneath it, August with those dark, quiet eyes that seemed to absorb information the way dry ground absorbs water. She decided on honesty because she understood, with the instinct of someone who has been evaluated her entire life, that anything less would be both noticed and remembered. Because in St. Louis, there is a limit to what a woman can learn in a hospital setting. "I wanted more." Vance's expression did not change. He set down his fork and leaned back slightly, and what he said next changed everything. "I need to be clear with you, Miss Whitmore. The mail-order bride letter was written by all 3 of us. The town has started asking questions. 3 men living together. No wives, no families. Reverend Pruitt has written to the governor twice. A 3rd letter will force an investigation. A marriage legitimizes this household." The room was very quiet. Clara could hear the stove ticking as it cooled. She could hear the wind outside pressing against the windows. "The marriage can be on paper only." Vance continued, "If that is what you want. But what I actually need is a surgical nurse. Someone who can assist without being told what to do every 30 seconds. Someone who can learn fast and work under pressure and keep her mouth shut about what happens inside these walls." August spoke for the first time that evening. His voice was low measured, carrying an accent that Clara could not immediately place. French perhaps, though softened by years spent elsewhere. Miss Whitmore came here because she wants to learn. We are here because we need someone who can assist. It seems to me that everyone's interests are aligned. Roth leaned back in his chair. And if her interests expand beyond assistance, he said, then we teach her. That is what we do. Clara looked at each of them in turn. Vance with his granite face and his surgeon's hands and his absolute unshakable authority. Roth with his warm eyes and his scarred knuckles and his way of making complicated things sound simple. August with his silence and his shadows and his habit of appearing exactly where he was needed most. She was a virgin, a minister's daughter, a woman who had been taught that her body was a temple and her virtue was the lock on the door, and she was sitting at a table with three men who were telling her in terms that were both honest and slightly terrifying that the arrangement she had signed up for was not the one she would be living in. She should have been afraid. She was not afraid. She said, I was not traded like a horse. I chose to come here, and I choose to stay. But I have one condition. I learn surgery. Actually learn, not pretend to assist while you do everything. Vance looked at her for a long time, longer than he had looked at her in the doorway, longer than he had looked at the ruptured spleen. And something moved across his face, something that was not quite a smile, but was in the neighborhood of one, the very far outskirts of one. Deal, he said. The wedding took place 1 week later at the Redemption Community Church. Reverend Thomas Pruitt performed the ceremony with a reluctance that bordered on hostility. He was a tall, thin man with a permanent expression of disappointment, the kind of clergyman who believed that social order was God's will and that deviation from it was not merely wrong, but genuinely dangerous. 3 unmarried men sharing a household was in his cosmology a sign of decay. Clara wore a simple white dress that Vance had purchased from the general store. It did not fit perfectly. Nothing in Redemption fit perfectly. Roth and August sat in the front pew as official witnesses. Martha Pruitt sat in the back, her hands folded in her lap, her face carefully neutral. What Clara did not see, because her back was to the window, was Henry Dawson standing outside the church. Not inside, outside, watching through the glass with an expression that was not anger exactly, but something more calculated than anger. Something that was taking measurements and making plans. His son stood beside him, a boy of 14, thin and sunburned, with his father's jawline and his mother's eyes. Tommy, the boy said, "Why are we not going in?" Dawson looked down at his son. "Because some things you see more clearly from outside," he said. Then he turned and walked away. Tommy looked back at the church one more time before following his father. Remember that boy. Remember his name. It will matter soon. When Pruitt said, "You may kiss the bride," Vance leaned in and pressed his lips to Clara's forehead. Light, brief, precise. She felt the warmth of it for exactly 1 second. Then he stepped back. His face was unreadable, but his right hand, his cutting hand, trembled slightly. Clara saw it. She said nothing. That night, the night that was supposed to be her wedding night, Clara lay alone in what was now officially her room. Vance's room, the largest of the 4 bedrooms on the 2nd floor. A wide bed with a quilted coverlet, a wardrobe, a desk beneath the window. A lamp she had extinguished 20 minutes ago. Vance was not there. He had given her the room and moved to the smaller one at the end of the hall. A gentleman's gesture or a physician's pragmatism or something else entirely that Clara did not have the vocabulary to name. She lay in the dark and listened to the wind. Wyoming wind is not like other wind. It does not whisper. It howls. It throws itself against the walls like something alive and furious, something that wants in. She was a virgin bride on her wedding night alone in a cold bed, and instead of feeling relieved, she felt something that frightened her more than anything she had encountered since stepping off the stagecoach in Redemption. She felt disappointed. She thought about Vance's hand trembling when he kissed her forehead, about the way Roth had watched her during the ceremony, not the way you watch a bride, but the way you watch a new colleague, whose capabilities you are still assessing. About August, standing at the church door after the service, his back to everyone, his face turned toward the mountains, as though he were standing guard against something Clara could not yet see. 3 men, 1 arrangement. And she, Clara Whitmore now, Clara Vance lay here wondering what exactly she had walked into. A soft knock on the door. Clara sat up. The door opened. "August." He did not step inside. He stood on the threshold, the hallway lamplight, casting his shadow across her floor like a long, dark finger. "There are horses outside," he said, "3 of them." They rode past Vance Medical and then circled back. Twice. Clara's pulse quickened. Who Dawson's men? They are counting, seeing who sleeps where. The wedding had not fooled Dawson. He was watching. "Lock the door when I leave," August said. "Do not open it for anyone except the 3 of us." He disappeared without a sound. Clara locked the door. She sat on the edge of the bed in the dark, listening to the wind and the silence and the sound of her own breathing, and for the first time since arriving in Redemption, she felt afraid. Not of the men outside, not of Dawson or Pruitt or the governor or any of the forces that were apparently aligned against the household she had just legally joined. She was afraid of herself, of the disappointment she had felt lying alone in that bed, of the way her body had responded to Vance's trembling hand, to Roth's steady gaze, to August's quiet presence in a dark doorway, of the growing impossible, undeniable suspicion that she had not come to Wyoming to learn medicine. She had come to Wyoming to learn something else entirely. And the most terrifying part was that she was beginning to think they knew it too. The first week passed in a blur of blood and carbolic, in the rhythmic, exhausting work of learning a new world from the inside out. Clara learned the layout of Vance Medical, the way a soldier learns the layout of a battlefield by necessity and repetition, and the certain knowledge that getting lost could cost someone their life. The examination room. The surgical suite in the back, larger than the examination room, with its heavy wooden table and its glass-fronted cabinets full of gleaming instruments. The storage room where supplies were kept in labeled wooden crates organized by a system so meticulous it bordered on obsessive. And the small laboratory where August prepared his compounds, a space that smelled of alcohol and herbs, and something faintly metallic that Clara could not identify. She learned the inventory system, color-coded, maintained in a leather-bound ledger that Vance updated personally every evening without fail. She learned the patient schedule, which was unpredictable and dictated primarily by the arrival of injured men from the surrounding ranches and mining camps. And she learned to watch. Vance was the strategist. He assessed each case in seconds, made decisions without hesitation, and delegated tasks with absolute clarity. He did not raise his voice. He did not need to. His authority was not performed. It was structural, built into the way he moved and spoke and occupied space. When Vance entered a room, the geometry of the room changed. Roth was the technician. His hands were the steadiest Clara had ever seen. He could suture a wound in half the time it took most surgeons, and his stitches were so even they looked like embroidery. But what made him exceptional was not his speed or his precision. It was the way he talked to patients. He explained what he was about to do before he did it. He asked permission before he touched. He made men who were frightened and in pain feel as though they were participants in their own healing rather than victims of it. August was the alchemist. He prepared every compound used in the practice, from simple carbolic solutions to complex analgesic tinctures that appeared in no medical text Clara had ever read. He also had an uncanny ability to predict complications before they occurred. He would look at a patient for 10 seconds, then say something like, "Check the right eye. Yellowing, liver is beginning to fail." And he was right every time. Every single time. They moved around each other with a kind of wordless precision that continued to unsettle Clara. Not because it was wrong, because it was too right, too smooth, too practiced for men who had been working together for 2.5 years. It looked like a decade of partnership compressed into a fraction of the time, and Clara could not figure out how they had achieved it. She filed that question away with all the others, the growing stack of things she did not yet understand. On the 8th day, Vance let her touch a patient, a miner with an infected finger. Simple case. Lance the abscess drain, irrigate dress. Clara did it, clean correct by the textbook. Vance examined her work. "Competent," he said. "Thank you. Competent is not the same as good. You hesitated before making the incision." "Why? I was waiting for confirmation." "I already gave you confirmation when I told you to do it. If you wait for permission every time you need to make a cut, you will be too slow. Speed matters, decisiveness matters, and the ability to trust your own hands matters most of all. Do you understand?" "Yes." "Good. In 3 days, you will perform your first unsupervised extraction. I will be in the room, but I will not intervene unless you are about to kill someone." That night, after the patients had gone and the instruments had been cleaned and the ledger had been updated, Roth found Clara in the storage room. He leaned against the door frame in that casual, loose-limbed way of his arms, crossed expression, somewhere between amused and serious. He told her about Philadelphia, about a woman with a septic uterus who was going to die if someone did not operate, about performing the surgery without her husband's consent because her husband was a judge who believed that his wife's pain was God's will, about the judge who had destroyed Roth's career by accusing him of having an affair with a woman who had been unconscious on an operating table. Vance was the only one who wrote back, Roth said, after I sent letters to every practice west of the Mississippi. 32 letters. One reply. He did not ask me where I came from. He did not ask me why I left. He asked me if I could do the work. He moved closer. Clara became aware of the dimensions of the room. Small, late, nearly 10 o'clock. Lamplight making the shadows lean in. You asked what I think of you, Ross said. The truth is, I think you are braver than you think you are. And you will do very well here as long as you stop waiting for permission and start taking it. He paused at the door on his way out. Vance said you were competent. For Vance, that is the highest praise there is. It took me 6 months to earn that word. He left. Clara stood alone with the bandages and the ledger and the strange, unfamiliar sensation of having been seen by a man in a way that was both flattering and faintly dangerous. She went upstairs. She did not sleep for a long time. The extraction happened 3 days later. Railroad worker, abscessed molar, 2 weeks of pain. Clara stood before the patient with the forceps in her hand and her heart beating faster than it should have been and her hands steady despite the adrenaline. Vance stood in the corner with his arms crossed. August prepared the ether. Roth arranged the forceps by size. Vance said one word. Proceed. Clara gripped the tooth, applied steady controlled pressure, rotated slightly to break the ligament, pulled straight out. The tooth came out clean. Vance nodded once. Good. Clean. Efficient. Next time, do not hold your breath while you are working. It makes your hands shake. Later in his private office, Vance sat her down and said the words that drew the line between everything that came before and everything that would come after. There is a difference between an assistant and a partner, he said. An assistant follows instructions. A partner anticipates needs, asks questions, challenges assumptions. An assistant is replaceable. A partner is not. He leaned forward slightly. I am offering you the opportunity to earn that position. It will require you to push past every boundary you were taught to respect in St. Louis. It will require you to learn anatomy the way it is actually practiced, not from books, but from experience, from touch. And it will require you to work more closely with Elias August and myself than you have ever worked with anyone. How closely medicine is an intimate profession, Mrs. Vance. We see people at their most vulnerable. We touch them in ways that would be inappropriate in any other context. In this practice, we acknowledge that reality instead of pretending it does not exist. Clara looked at this man, her husband on paper, a stranger in practice, a surgeon whose hands trembled when he kissed her forehead but did not tremble when they were buried inside a human body. I came here to learn, she said, whatever that requires. Vance smiled. The first time she had seen him smile, it changed his entire face, cracked the granite, let something warm and almost human show through the fissures. Then he added one more thing, and the warmth disappeared. The territorial marshal will be here in 3 months. Routine inspection accelerated by Dawson's complaints. By then you need to be good enough to pass any examination he conducts. Because if he discovers that you are performing procedures without a medical license, it is not just you who loses everything. It is all 3 of us. 3 months. That was the deadline. Clara stood up. She looked at Vance across the desk, across the careful distance he maintained between himself and everything he cared about. Then we had better start tomorrow, she said. Tomorrow, he agreed. 6 in the morning. Do not be late. She was not late. She was never late again. The anatomy lessons began on a Tuesday evening after the last patient had limped out the front door and the examination rooms had been scrubbed and the instruments had been boiled and returned to their cabinets. Clara was in the storage room counting rolls of gauze when Roth appeared in the doorway. Vance wants you in the surgical suite. She followed him down the hallway through the examination room and into the surgical suite at the back of the building. The room was larger than the examination room, windowless, lit entirely by oil lamps that cast the kind of warm, unsteady light that made everything look slightly alive. A heavy wooden table occupied the center of the floor. Cabinets lined the walls, their glass doors revealing rows of instruments that gleamed like the teeth of something patient and waiting. Vance stood beside a second table against the far wall. August stood on the opposite side. Between them, covered by a white sheet, was a shape that Clara recognized immediately. She had seen cadavers before. Every nurse in training had. But those cadavers had been displayed in lecture halls surrounded by rows of students and presented as educational tools rather than as people who had once been alive. They had been old, preserved, abstract. This was different. Vance pulled back the sheet. The body beneath it was male, perhaps 40 and fresh. The skin was pale, but not yet discolored. There was no smell of decay. The preservation was recent and skillful. August's work formaldehyde solution applied with the kind of precision that kept tissue viable for weeks. Clara looked at Vance. Where did you get this A minor who died 3 days ago? No family, no one to claim the body. I purchased it from the town undertaker for the purpose of anatomical study. It is legal if unconventional. He picked up a scalpel from the instrument tray and held it the way a conductor holds a baton, with authority and intention and a kind of controlled grace. The human body is not a mystery, Mrs. Vance. It is a machine. An elegant machine, certainly, but a machine nonetheless. And like any machine, it can be understood through systematic disassembly and observation. That is what we are going to do tonight. He made the first incision, a long, clean line down the center of the chest. Clara watched as he peeled back the skin, exposing the muscle tissue beneath the lamplight, catching the edges of the incision, and turning it into something that looked less like a wound and more like an opening into a different kind of landscape, a geography of the interior. Vance continued. The thoracic cavity contains the heart, the lungs, the major vessels. To access it surgically, you must navigate through layers of muscle, fascia, and bone. Every layer has a purpose. Every structure has a function. Your job is to learn where everything is, how it works, and how to move through it without causing unnecessary damage. He glanced at Clara. Come here, stand beside me. Clara moved to his left side, positioning herself so that she could see directly into the open chest cavity. The smell hit her then, not decay, but something chemical and organic at the same time, formaldehyde and copper, and the particular wet smell of tissue that has been recently alive. Vance handed her the scalpel. Show me the intercostal muscles. Clara took the scalpel. Her hand did not shake. She identified the muscles between the ribs, traced them with the tip of the blade, and looked at Vance for confirmation. He nodded. Correct. Now show me the phrenic nerve. She found it, a thin white thread running along the surface of the pericardium, delicate as a strand of silk carrying the electrical impulse that told the diaphragm to contract to breathe to keep the body alive. Good. Roth showed her the posterior mediastinum. Roth stepped closer. He positioned himself just behind Clara's right shoulder, close enough that she could feel the warmth of him through the fabric of her dress, the solid presence of his body in the narrow space between her and the table. He reached past her, his arm brushing against hers, and pointed with one gloved finger at a structure deep within the chest cavity. There, he said, the descending aorta, and just beside it the thoracic duct. His voice was quiet, measured close enough that she could feel the vibration of it in the air between them, the way you can feel thunder before you hear it. Clara leaned in slightly to see where he was pointing. Roth did not step back. August moved to her left side, mirroring Roth's position with the kind of silent symmetry that suggested this was choreographed or at least practiced. And here, he said, his accent softening, the consonants is where you will find the vagus nerve. It controls heart rate, digestion, respiratory rate. Damage it during surgery and the patient dies slowly, sometimes over days. Clara was suddenly and acutely aware of her position. Standing between two men in a warm, windowless room, her hands inside a human chest, her heart beating faster than it had any medical reason to beat. 3 points of awareness, Roth's arm against hers, August's shoulder near her own, and Vance watching from across the table with those Winter Creek eyes that missed nothing. Are you uncomfortable, Mrs. Vance? No. Good. Because discomfort is a distraction, and distraction is dangerous. If you are going to work in close quarters with us, you need to be able to focus on the anatomy, not on who is standing beside you. He stripped off his gloves. That is enough for tonight. Clean the instruments and cover the body. We will continue tomorrow. He left the surgical suite. Roth and August remained. Clara exhaled slowly and realized that she had been holding her breath again. She pulled off her gloves and dropped them into the waste basin. Roth said, "You did well. I identified two structures. That is not doing well. You did not faint. You did not look away. You did not ask to leave. In my experience, that counts as doing well." August began collecting the instruments for cleaning. Without looking up, he said, "Vance is testing you. He wants to see if you will become distracted by proximity." Many people do. They learn medicine in lecture halls where everyone stands 3 feet apart and touches nothing but books. Then they enter a surgical suite and discover that surgery requires you to stand shoulder to shoulder with other people, to reach past them, to move in synchrony with them, to trust them with your hands and your attention, and sometimes your weight when you lean across a table to see something on the other side. He glanced at her. It is intimate work, not in the romantic sense, in the practical sense. And if you cannot handle that kind of intimacy without becoming self-conscious, you will be slow. And slow gets people killed. Clara nodded. "I understand." "Do you?" She looked at him directly. His dark eyes held hers for a moment that felt like a small, quiet test. Then he nodded and returned to the instruments. Roth dried his hands and moved toward the door. "Get some rest, Clara. Tomorrow will be longer." They left. Clara stood alone in the surgical suite with the covered body and the lingering smell of carbolic and the strange, unnerving realization that she was not uncomfortable at all. What she was, though she did not yet have the courage to name it, was exhilarated. The lessons continued every evening for the next 2 weeks. Each session followed the same pattern. Vance would demonstrate a technique or identify a structure. Roth would provide context explaining the surgical implications, the what could go wrong, and how to fix it. August would add details that no textbook had ever mentioned, information drawn from a body of knowledge that seemed to exist outside the curriculum of any medical school Clara had heard of. And Clara would stand between them, learning to navigate the human body the way a cartographer learns to navigate unmapped territory. By touch, by repetition, by the accumulating confidence that comes from doing something difficult again and again, until it becomes something you know in your hands rather than something you know in your head. She learned the layers of the abdominal wall, the structure of the pelvis, the branching of the femoral artery, the arrangement of nerves in the brachial plexus. She learned to make incisions without hesitation, to dissect tissue planes without tearing them, to identify structures by touch alone when visibility was limited. And she learned to work in proximity, a hand on her wrist to adjust her grip on a scalpel, a hand on her shoulder to steady her when she leaned too far across the table, a hand on the small of her back to guide her into position when they needed to work on opposite sides of the same incision. None of it was inappropriate. All of it was deliberate. They were desensitizing her to physical contact so that she could function in a surgical environment without being distracted by the simple fact that another human being was touching her. It was practical, it was professional, and it was working. By the end of the second week, she could stand with Roth's arm pressed against hers during a difficult dissection without noticing the contact until after it was over. She could feel Vance's hand on her shoulder and register it only as instruction rather than as touch. She could work alongside August in a space so confined that their bodies were in constant contact and focus entirely on the anatomy in front of her. But there was a difference between becoming accustomed to proximity and becoming indifferent to it. And Claire was discovering with increasing clarity that she was not indifferent at all. She was aware of the way Roth's hands moved when he demonstrated a technique confident and precise, the way his fingers wrapped around the handle of a scalpel as though the instrument were an extension of his own body. She was aware of the way Vance's voice dropped when he was explaining something complex, becoming quieter and more deliberate as though he were sharing a secret rather than delivering a lecture. She was aware of the way August watched her when he thought she was not paying attention, his dark eyes following the movement of her hands, tracking the way she learned, cataloging every mistake and every success with the same quiet intensity. She was aware of all of it, and she was beginning to suspect that they were aware of her awareness. And then everything that was careful and gradual and controlled was interrupted by a 14-year-old boy who had been in pain for 3 days because his father thought suffering built character. It was a Tuesday evening. Clara had been at Vance Medical for 5 weeks. She was in the storage room when she heard the front door open and a voice she did not recognize shouting for Dr. Vance. She came out to find a ranch hand hat in his hands, dust on his clothes, standing in the waiting area with a boy slung over his shoulder like a sack of grain. The boy was Tommy Dawson. He was barely conscious. His face was the color of old paper. Sweat had plastered his hair to his forehead and soaked through his shirt. When the ranch hand laid him on the examination table, Tommy curled into himself, his knees drawing up toward his chest, his hands pressed against his lower right abdomen. The ranch hand was talking fast. Said he has been hurting for 3 days. Mr. Dawson told him it would pass. Said the boy was being soft. But this morning he could not stand. I brought him without asking. Mr. Dawson is out checking the herd 2 days' ride north. Vance examined Tommy in silence. His hands moved across the boy's abdomen with a gentleness that Clara had not seen before, the kind of gentleness that comes not from softness, but from the knowledge that what lies beneath your fingers is fragile and failing. He pressed gently on the lower right quadrant. Tommy screamed. Vance gave no outward reaction, but something in his eyes went dark and still, the way water goes still before it freezes. Appendicitis, he said, ruptured. Peritonitis has begun. We operate now. The surgical suite. Nighttime. Lamps turned up full. Tommy on the table, stripped to the waist, his thin chest rising and falling too fast. August at the head, administering ether through a cloth mask with the careful, measured movements of a man who understood that the distance between unconsciousness and death was measured in drops. Roth on the left side, instruments laid out, sutures threaded ready. Vance on the right, scalpel in hand. Clara across from him, assisting. Vance opened the abdomen. What came out was worse than anyone expected. The appendix had not just ruptured. It had been ruptured for at least 2 days, leaking infection into the abdominal cavity, like poison from a broken bottle. Pus everywhere. The tissue was inflamed, angry red shading to gray in places where the infection had killed the cells outright. The smell was something Clara would never forget, sweet and rotten and alive, the smell of a body at war with itself and losing. They fought for 4 hours, irrigating the abdominal cavity, debriding infected tissue, suturing. August prepared an antibacterial compound from his personal pharmacopoeia, herbs and minerals, and something else that Clara could not identify, ground together with a mortar and pestle and dissolved in a solution that he applied directly to the infected tissue. Halfway through the surgery, Tommy woke up. It happens sometimes with ether. Rare, but it happens, and when it does, it is one of the most terrifying things that can occur in a surgical suite. One moment the patient is unconscious and still. The next they are screaming, thrashing their body, responding to the pain. It suddenly remembers their hands reaching for the wound, for the instruments, for anything they can grab to make it stop. Roth caught Tommy's arms. Clara moved without thinking. She placed her hand on the boy's forehead, cool and firm, and she leaned close and said, "Shh, I am here. I am right here. You are safe." Her voice was steady. Her hand was steady. She did not know where the steadiness came from. It was simply there, rising up from somewhere inside her that she had not known existed until this moment. August increased the ether. Tommy went under again. His body relaxed. His breathing slowed. But in the seconds before the ether took hold, Clara's eyes met Vance's across the operating table, and what she saw in his face stopped her breath. Fear. Not the kind of fear that comes from uncertainty about a procedure. Vance had performed hundreds of abdominal surgeries. This was something else, something deeper, something personal. He was looking at Tommy Dawson the way you look at something you have already lost, the way you look at a memory rather than a patient. Clara did not understand it then, but she would. And when she did, it would change the way she saw him forever. Tommy lived through the night. He lived through the next day. On the 3rd day, his fever returned. On the 4th day, he began seizing. Clara sat by his bed through the 4th night, changing his dressings, monitoring his temperature, talking to him even though he could not hear her, telling him about St. Louis, about the hospital, about the train ride west, and the way the sky in Wyoming was so wide it made your chest hurt. On the 5th day, Tommy Dawson died. He died at 4:17 in the morning, in the gray light before sunrise, with Clara holding his hand, and Vance standing at the foot of the bed, and Roth sitting in the chair by the window, and August standing in the doorway with his arms crossed and his face turned away. He died the way children die, quietly, as though the business of leaving the world were simpler and less dramatic than the business of entering it. His breathing slowed. Then it slowed more. Then it stopped. Clara held his hand for a long time after it stopped. She did not know why. There was no medical reason. The boy was gone, but her fingers would not release his, as though some part of her believed that letting go would make it real in a way that mere dying had not. Vance reached down and gently separated her hand from Tommy's. His touch was careful, clinical, but his fingers lingered on hers for a fraction of a second longer than necessary, and Clara understood that the gesture was not professional. It was human. Henry Dawson arrived 6 hours later. He came through the front door of Vance Medical without knocking. He was a big man, 55 years old, with the kind of physical presence that comes from decades of outdoor work and the particular kind of authority that comes from owning more land than anyone else within 100 miles. His face was sunburned and hard, the face of a man who had built something out of nothing and intended to keep it. He stood in the examination room and looked at the body of his son laid out on the table, cleaned and dressed, his arms at his sides, his eyes closed. Dawson did not cry. His face did not move. He stood there for a long time looking at the boy, and the stillness of him was worse than any grief Clara had ever witnessed. Then he looked at Vance. "You killed my son." Vance's voice was steady. "We did everything we could, Mr. Dawson." "Peritonitis at that stage of progression?" Dawson cut him off. "I did not ask what you did. I am telling you what happened. You killed my son, and I will make sure every person in this territory knows it." He looked at August, a long look, cold, calculating. "And I hear you used your herbs on my boy, your medicines that come from no pharmacy any honest man has heard of." He looked at Clara. "And you, the new wife, the nurse, I hope you did not put your hands on my son." Clara met his gaze and said nothing. There was nothing to say. The man's son was dead. No words would change that. No explanation would soften it. The only thing she could do was stand there and absorb his rage the way a breakwater absorbs waves, by being solid, by not moving, by letting the force of it crash against her and fall back. Dawson left. The front door slammed behind him hard enough to rattle the glass in the cabinets. And Clara knew with the certainty of someone who has just watched a fuse being lit that the explosion was coming. The only question was how large it would be. It was large. Within a week, Dawson had written to the territorial marshal, the medical board in Cheyenne, in the governor's office. His accusations were specific and devastating. Unorthodox medical practices. Use of unregulated pharmaceutical compounds on a minor. Negligence resulting in death. He named August, specifically calling his treatments primitive and his credentials fraudulent. He did not name Clara directly, but the implication was clear. A woman performing medical procedures beyond her qualification. Reverend Pruitt seized the opportunity with the enthusiasm of a man who has been waiting for exactly this kind of ammunition. His Sunday sermon was a masterwork of righteous indignation delivered to a congregation that included nearly half the town. "God punishes pride," Pruitt said from his pulpit, his voice carrying through the open windows and into the street beyond. Three men who set themselves up as healers, who presume to hold the power of life and death in their hands, who live together in a manner that offends decency and invites judgment. And now a child is dead. Is this not the consequence of hubris? Is this not the price of defying the natural order that God himself established? The consequences were immediate. Dawson ordered every ranch hand on his payroll to stop using Vance Medical. Other ranchers followed. Patient volume dropped by more than half within 2 weeks. The women of redemption, who had never been particularly welcoming to Clara, now actively shunned her. No invitations to tea, no conversations at the general store, eyes that looked away when she walked down Main Street. Clara was isolated, completely, thoroughly, socially cut off from every woman in a town of 800 people. One night, someone threw a rock through the front window of Vance Medical. Wrapped around it was a piece of paper with 3 words, "Leave or burn." Vance picked up the rock, unfolded the paper, read it, folded it again, placed it in his coat pocket, and returned to the patient chart he had been reviewing. His expression did not change. But Clara saw him open the top drawer of his desk and check the Colt Navy revolver he kept there, running his thumb along the cylinder with the ease of long practice. She had not known about the gun until that moment. She wondered what else she did not know. Henry Dawson was not finished. He was, in fact, just beginning. The letter arrived from Denver 3 weeks after Tommy's death. Dawson had found what he was looking for. A physician. A real one by Eastern standards. A man with credentials and connections and the particular kind of professional authority that comes from having trained at institutions that most people have actually heard of. Dr. James Harwell arrived in Redemption on the morning stagecoach, carrying a leather medical bag and wearing a black suit that looked exactly as out of place on Main Street as it was intended to look. He was 48 years old, gray at the temples, thin-lipped with the kind of posture that suggested he had never in his life leaned against a doorframe or sat in a chair without being invited. He walked into Vance Medical without knocking. Clara was the first to see him. She was in the examination room reorganizing the instrument cabinet when the front door opened and a man she had never seen before stepped inside and looked around the room with the particular expression of someone inspecting a property they are considering purchasing and finding it beneath their standards. His gaze moved across the room, over the instruments, over the cabinets, over Clara, pausing on her for exactly long enough to register disapproval before moving on. Then Vance entered from the back room and Harwell's attention locked onto him like a compass needle finding north. "Dr. Vance, I have heard a great deal about your practice." Vance stopped. He looked at Harwell the way he looked at every new variable that entered his carefully controlled environment, with a stillness that was not passivity, but calculation. "And you are Dr. James Harwell, Denver, recently relocated to Redemption to establish an independent practice. Healthy competition, you might say. I might say that Henry Dawson is paying you." Harwell smiled. It was the kind of smile that had no warmth in it. "Direct. Good. Then I will be direct as well. I will be opening a practice on the other end of Main Street. I will be offering the people of Redemption an alternative to your methods. And I will be paying very close attention to what happens inside these walls." His gaze found August, who had appeared in the doorway to the laboratory. He looked at August for a long time, and what was in that look was not curiosity. It was something older and uglier than curiosity. "And you must be the one who trained in Paris," Harwell said. "Interesting credentials for this part of the country." August said nothing. He stood in the doorway with his arms crossed and his face as expressionless as a closed door, and he said absolutely nothing. Harwell turned back to Vance. His eyes found Clara again. "Mrs. Vance, is it the nurse?" He let the word nurse sit in the air for a moment, waited with implication. "I do hope you are confining your activities to nursing." Then he left. The room was quiet for a long time after the door closed. Clara looked at Vance. Vance looked at August. August looked at no one. Finally, Roth, who had been standing in the hallway listening to the entire exchange, said what everyone was thinking. "Well, that is going to be a problem." Clara found August that night in his laboratory, the small room that smelled of alcohol and herbs, and the faintly metallic compound she still could not identify. He was sitting on a stool, his back against the wall, his hands in his lap. He was not working. He was not doing anything. He was simply sitting there, and the stillness of him was different from his usual quiet. It was the stillness of a man who was tired in a way that sleep could not fix. She sat down across from him. She did not ask permission. She did not announce herself. She simply sat the way he would have done and waited. After a long time, he said, "Harwell is right about one thing. My credentials are unusual. For this part of the country, that is a polite way of saying they are suspicious. A man who looks like me with a degree from Paris tends to make certain people uncomfortable." Clara said, "He is not uncomfortable. He is threatened." August looked at her. There was something in his eyes that she had not seen before. Not sadness exactly, weariness. The kind that comes from fighting the same weight for so long that you can no longer remember what it was like to not be fighting, he told her. Not everything, not yet, but enough. His mother was a traditional healer in New Orleans. Creole, a free woman of color who knew more about the medicinal properties of plants than most pharmacists who had spent years in universities. August had learned from her first, then from the medical school in Paris, and when he returned to New Orleans, he had tried to combine both traditions, Western surgery and pharmaceutical science, with the herbal knowledge his mother had passed down through generations. It worked. His patients recovered faster, reported less pain, developed fewer infections. And then a wealthy white man died in his care, not from August's treatment, from a pre-existing heart condition that no medicine on earth could have fixed, and suddenly everything August had built became evidence of something sinister. "They called it poisoning," August said. His voice was flat. Matter of fact, as though he were describing a case study rather than the destruction of his life. They said my herbs were toxic, that I had killed him intentionally. My mother helped me leave the city. I do not know if she is still alive. Clara reached across the space between them and took his hand. Not the way a lover takes a hand, Omtun. The way an ally takes a hand. The way someone who understands what it means to be told that what you are is not enough takes the hand of someone who has been told the same thing in a different language. You are here, Clara said. No one is driving you out. August looked down at her hand on his, at the contrast of her pale fingers against his darker skin, at the simple fact of contact offered without agenda. Not yet, he said. But what was happening outside the walls of Vance Medical was not the only thing changing. What was happening inside was changing too. The anatomy lessons continued. But something had shifted in the wake of Tommy's death, in the space carved out by grief and threat, and the growing awareness that the practice they had built could be dismantled at any time by forces beyond their control. The lessons became more intense, more focused, more urgent. As though the ticking clock that Vance had warned Clara about the marshal arriving in 3 months had suddenly become audible marking time in a rhythm that grew faster with each passing week. It was during one of these sessions, a Thursday evening in late April, that the line between education and something else finally blurred. Vance was teaching arterial ligation, the technique for tying off a severed artery during trauma surgery. He demonstrated the procedure on the cadaver, then stepped back and looked at Clara. Your turn. She stepped forward, positioned herself at the table, picked up the ligature thread. The artery in question was the brachial artery, located deep in the upper arm, requiring dissection through multiple layers of muscle and fascia while avoiding the surrounding nerves. She made the first incision. Roth moved to her right side close enough that she could feel the heat of him through the fabric of her dress. Deeper, he said. You are being too cautious. She adjusted and cut deeper. August appeared on her left. Watch the median nerve. It runs parallel to the artery. If you damage it, the patient loses function in the hand. Vance's voice came from behind her. Do not slow down. Speed matters. Find the artery, ligate it, and move on. She found the artery, a pale cord-like structure running through the muscle tissue. Roth reached past her, his hand covering hers on the scalpel. Here, feel the angle. He guided her hand, adjusting the blade's position by a fraction of an inch. Clara felt the shift in resistance as the scalpel found the correct tissue plane. Roth's hand remained on hers. Warm, steady, certain. There, do you feel it? Yes, good. Now ligate. She picked up the ligature thread with her free hand. August's hand appeared, steadying the tissue on the opposite side of the incision. His fingers were long and precise. Loop it twice, he said. Pull tight, but not too tight. You want to occlude the vessel without tearing it. Clara looped the thread, pulled. The artery collapsed. The ligation held. Vance stepped closer, positioning himself directly behind her so that when she straightened slightly, her back brushed against his chest. Check for bleeding. She checked. No bleeding. Good. Now close. But Roth's hand caught her wrist before she reached for the suture. Wait. She looked at him. He was watching her with an expression she could not fully read. Intent. Assessing. And something else beneath it, something that had been building for weeks and was now close enough to the surface that she could almost see it. Before you close, he said, I want you to feel something. He guided her hand back into the incision, positioning her fingers against the exposed artery just above the ligature. Do you feel that a pulse, faint but steady, the heart still beating, preserved by August's formaldehyde solution, a ghost of rhythm in dead tissue? Roth's hand remained on her wrist. His thumb rested against the inside of her forearm, exactly where her own pulse was running fast and visible beneath the thin skin. That is what you are controlling when you ligate an artery, he said. Not just blood flow, the rhythm of life itself. His thumb moved slightly against the inside of her wrist. Not a caress, a pressure, a small, deliberate alignment of his touch with her pulse, as though he were synchronizing himself to the machinery of her body. Clara's breath caught. Vance's hand came to rest on her shoulder, not guiding this time, just present, heavy, warm. August's hand was still on the tissue, but his fingers had shifted no longer, just holding the incision open, but resting against the back of her hand where it curved into the body cavity. 3 points of contact. 3 men. One woman standing between them in a warm room with her hands inside a corpse and her heart beating so loudly she was certain they could all hear it. Vance's voice was quiet. "Are you distracted?" "Mrs. Vance," she should have said yes. She said no, then closed the incision. Roth released her wrist. August withdrew his hand. Vance stepped back. Clara sutured the incision with hands that were steadier than they had any right to be. When she finished, Vance examined her work. "Excellent. Clean up. Tomorrow we have a full schedule." He left the surgical suite. Roth and August remained. Clara stripped off her gloves and dropped them into the waste basin. Her hands were shaking now, the adrenaline catching up. Roth stepped closer. "That was a test." "I know. Did you pass?" Clara looked at him. "Did I, Vance, think so? And you?" Roth's expression shifted. "I think you are either very brave or very reckless. I have not decided which." August moved to stand beside Roth, the two of them forming a wall of presence that Clara had to tilt her head back slightly to meet at eye level. "There is a third option," August said, "which is that you want this. Not just the medical training, the proximity, the touch, the way it feels to stand between 3 men who are all paying very close attention to you." Clara could have denied it. She could have walked out of the surgical suite and returned to her room and pretended that this conversation had never happened. She could have maintained every boundary that her father had preached and her mother had modeled, and every textbook, in every instructor, and every social convention had told her to value. She was a minister's daughter, a virgin, a mail-order bride who had never been kissed, except on the forehead, by a man who had done it the way you close a surgical wound, quickly, efficiently, with no wasted motion. And she was standing in a room that smelled of carbolic and blood, looking at 2 men who were offering her something that no one in her 21 years had ever offered her before. Not protection, not provision, not the conditional transactional safety of a marriage contract. Choice. She said, "And if I do want it?" August's expression softened into something that was almost a smile. "Then you should know that we want it too." The silence was not uncomfortable. It was charged. Electric. The kind of silence that precedes a thunderstorm, when the air goes still and the pressure drops and you can feel the potential energy humming in everything around you. Ross said Vance has a rule. No one touches you unless you ask. No one pushes. No one assumes. If you want more than anatomy lessons, you have to say so. Out loud, clearly. Do you understand? Clara understood. She understood more than they knew. She understood that this was not seduction. This was negotiation. This was 3 men who had learned through years of working in a profession that required absolute trust and absolute communication that the only way to navigate complicated territory was to talk about it first. She looked at Roth, then at August, then back at Roth. "I want more than anatomy lessons," she said. Roth exhaled slowly. "Then we should go find Vance." They found him in his private office, sitting at his desk with a patient file open in front of him and a glass of whiskey at his elbow. He looked up when the 3 of them entered. His gaze moved from Roth to August to Clara, and something in his expression shifted. Not surprise, recognition, as though he had been expecting this particular constellation of people to appear in his doorway on this particular night. "She asked," Roth said. Vance looked at Clara. "Is that true?" "Yes." "And you understand what you are asking for?" "I think so." "Thinking is not the same as knowing. I need you to be very clear, Mrs. Vance. If we proceed, the dynamic between us changes. Not in a way that diminishes your professional development, in a way that expands it. But expanded dynamics require expanded trust, and expanded trust requires honesty." He stood, walked around the desk, stopped a few feet in front of her, close enough that she had to look up to meet his eyes, close enough that she could see the lines around those eyes, the fatigue and the intelligence, and the pain that lived there permanently like sediment at the bottom of a deep river. "What do you want?" Clara took a breath. She felt in that moment the full weight of everything she was about to leave behind. The minister's daughter, the obedient nurse, the virgin bride who was supposed to be grateful for the safety of a paper marriage and the privilege of handing instruments to men who would never let her hold the knife. She let it go. All of it. She let it fall away from her like a surgical gown being untied and dropped to the floor. I want to learn anatomy the way you promised to teach it, not from books, not from cadavers, from living bodies, from experience, from touch. Vance looked at her for a long time. His voice was lower than she had ever heard it. 3 mountain men and a virgin bride. That is what they will call this if they ever find out. And they will be wrong about every part of it except the facts. Then he said 3 words. We start now. What followed was not sudden. It was incremental, careful, controlled. The way everything in Vance Medical was controlled with precision and intention and a respect for the process that elevated it above mere impulse. Vance's hand on her jaw, tilting her face upward. The mandible, he said, the strongest bone in the skull. But just beneath it here, his thumb moved lower, pressing gently against the soft tissue of her throat, is the carotid artery, the pulse point. Press here and the heart rate increases, not because of fear, because the body interprets pressure as threat and prepares to respond. Her pulse did increase, exactly as he described. Roth moved behind her. His hands came to rest on her shoulders. The trapezius muscle. It runs from the base of the skull to the mid-back. One of the largest muscles in the upper body. It holds enormous tension. When you are anxious, it tightens. When you are relaxed, it softens. His thumbs pressed into the muscle on either side of her spine. Clara felt the tension release like a caught breath, finally exhaled. August crouched in front of her at eye level. And this, his fingers found the inside of her wrist, pressing lightly, is where you check the radial pulse. But it is also one of the most sensitive areas on the human body. The skin here is thin. The nerves are close to the surface. His thumb moved in a slow circle against the inside of her wrist. Clara's breath hitched. 3 men, 3 points of contact, teaching her anatomy in a way that no textbook ever could and no textbook ever would. And somewhere in the space between education and exploration, between the clinical and the intimate, Clara Whitmore, 21 years old, virgin bride minister's daughter, understood something she had never understood before. Her body was not a temple to be locked. It was a landscape to be explored. And these 3 men were not invaders. They were guides. Vance watched her eyes. Are you uncomfortable? No. Are you afraid? No. Then what are you? She considered the question. She considered it honestly the way Vance had taught her to assess a patient without assumption, without judgment, with attention only to what was actually there. Attentive, she said. Vance's expression shifted into something that might have been approval. Good. Attention is what we need from you, not passivity, not compliance. Active, engaged attention. Do you understand? Yes. Then come with me. They went upstairs. To Vance's old room, the one he had given up on their wedding night, the largest bedroom with the wide bed and the desk beneath the window. He lit the lamp with steady hands and closed the door. And they taught her. They taught her the names of muscles she had only ever seen in diagrams, the paths of nerves she had only read about, the location of pulse points and pressure points in place where the skin was so thin you could see the vessels beneath it. They taught her with their hands and with their voices, with touch that was both educational and undeniably intimate, and Clara learned. She learned with her whole body, with every nerve ending, with the full attention that Vance had asked for and that she gave without reservation. Later in the quiet that followed, Vance pulled a blanket over her and said one word. Sleep. She did. In the morning, she woke alone and went downstairs and found them working. A rancher with a broken hand. They moved around each other with the same quiet efficiency as always. Clara joined them without a word. Vance glanced at her once, his expression unreadable, and returned his attention to the patient. But something had changed. When Roth's hand brushed against hers while reaching for a scalpel, she no longer registered it as accidental contact. When Vance's hand settled on her shoulder to guide her attention to an anatomical landmark, she understood the weight of it differently. When August stood close enough that she could feel the heat of him through her dress, she did not step away. The dynamic had shifted, not in a way that interfered with the work, in a way that deepened it. And then the door opened, and standing in it was a man in a black suit with a leather medical bag and an expression of professional contempt. Dr. James Harwell looked around the room. His eyes moved from Roth to August to Clara to Vance, and something in his face tightened. Dr. Vance, he said, I have heard interesting things about your evening activities. Anatomy lessons, I believe they are called. He smiled. The smile had no warmth in it, None at all. I do hope everything here is strictly educational. He turned and left. The door closed softly behind him. In the silence that followed, Vance said, "He knows." Roth said he suspects. There is a difference. August said nothing. He was looking at the door through which Harwell had disappeared, and his expression was the one Clara had seen on the faces of men who have been hunted before and recognized the sound of footsteps closing in. Clara looked at Vance. "What do we do?" Vance picked up a scalpel from the instrument tray. He turned it over in his hand, watching the lamplight slide along the blade. "We do what we have always done," he said. "We do the work, and we do it better than anyone else can." He set the scalpel down. "And we prepare for what is coming, because it is coming. That much is certain now." What none of them knew, what they could not have known, was that what was coming would be far worse than a territorial marshal or a medical board investigation, or even the slow strangulation of their practice by a grieving father's revenge. What was coming was a cholera epidemic, and it would arrive in 6 weeks. And before it was over, one of the four of them would be lying on the examination table fighting for their life, while the other three tried to remember everything they had ever learned about keeping a human being alive. But that, like everything else in Redemption, Wyoming, would happen on its own schedule. And no amount of preparation would make it easier when it came. The cholera came in August, riding the contaminated water like an invisible horseman down from the mining camps in the northern hills. It did not announce itself. It did not send warning. One morning, the town of Redemption was functioning normally, 800 people going about the ordinary business of living, and by nightfall, the first man was dead. His name was Earl Hutchins, 42 years old, miner. He walked into the Brass Spur Saloon at noon complaining of stomach cramps, and by 6 o'clock he was lying on the floor in a pool of his own fluids, his skin the color of old wax, his eyes sunken into his skull, his body expelling water faster than anyone could put it back in. August was the first to reach him. He took one look and said the word that changed everything: cholera. Within 3 days, 5 more cases. Within a week, 20. The disease moved through Redemption, the way fire moves through dry grass, following the path of least resistance, finding the vulnerable, the weak, the unlucky. It came through the water supply, through the creek that ran behind Main Street, through the wells that half the town drew from, through the simple act of drinking on a hot August day. Vance Medical was not large enough. It had never been large enough for something like this: 4 rooms in a surgical suite designed to treat injuries, not to contain an epidemic. By the 3rd day, Vance made the decision that would define the next 6 weeks of their lives. "We need the saloon," he said. The Brass Spur was the largest interior space in Redemption. 2 stories, a main floor that could hold 60 people, a second floor, with private rooms that could be converted to isolation wards. The owner, a man named Hank Guthrie, did not argue. His bartender was already sick. They converted the saloon in 12 hours. Clara and Roth carried tables out into the street while August prepared carbolic solution by the gallon, and Vance organized the space with the same meticulous precision he brought to everything. Cots arranged in rows, clean water stations, waste disposal area at the back, isolation room upstairs for the worst cases. And then the patients came. Not in ones and twos, in waves: miners, ranch hands, shopkeepers, children, old women, young men. They came stumbling down Main Street, or were carried by family members, or arrived in the back of wagons already too far gone to walk. They came with the same symptoms: the violent purging, the cramps, the rapid dehydration that turned a healthy person into a husk in a matter of hours. The 4 of them worked 18 hours a day, sometimes 20. Sometimes the hours blurred together, and Clara lost track of when one day ended and another began. She slept in 20-minute intervals on a cot in the corner of the saloon, waking to the sound of someone retching or crying or calling out for water. She changed dressings. She mixed rehydration solutions using August's formula: salt and sugar and clean water in precise proportions. She held basins for people who were too weak to turn their heads. She carried soiled bedding to the burn pile behind the building and returned for more. Vance was everywhere. He moved through the makeshift hospital like a general on a battlefield, assessing, deciding, delegating. His voice never rose, his hands never shook. But Clara could see the toll it was taking. The lines around his eyes deepened by the day. His cheekbones became more prominent as his body burned through fuel it was not replacing. He ate when Clara put food directly into his hands, and not otherwise. Roth worked the surgical side, treating the secondary injuries and complications that came with the epidemic. A man who had fallen during a seizure and broken his arm. A woman who had cut herself on broken glass while delirious. A child who had developed a secondary infection that was spreading faster than the cholera itself. Roth handled all of it with the steady patient competence that Clara had come to rely on like a second pulse. August was the pharmacist and the miracle worker. He prepared compounds around the clock, mixing and measuring and filtering, his small laboratory expanding to fill half the back room of the saloon. His rehydration formula was better than anything in the medical literature. His antibacterial compounds, the same ones that Harwell had called primitive and Dawson had called dangerous, were the only thing standing between some patients and death. He worked in silence as always, but the silence had changed. It was no longer the comfortable quiet of a man at peace with his solitude. It was the focused, desperate silence of someone racing against the clock only he could hear. Dr. James Harwell, the physician Dawson had imported from Denver to compete with Vance Medical, did not help. He stood on the porch of his newly opened practice at the other end of Main Street and watched the patients being carried into the brass spur. Someone asked him if he was going to assist. Harwell straightened his cuffs and said, "I was not hired to practice their methods. If people wish to seek treatment from me, they are welcome. I will not participate in a medical exercise that uses unregulated compounds." The people of Redemption heard this. They filed it away. They would remember it later. Martha Pruitt broke ranks on the fourth day. She appeared at the back door of the brass spur at midnight, carrying 2 buckets of clean water from the church well and a stack of blankets she had taken from the parsonage without her husband's knowledge. She set them down, looked at Clara, and said, "Tell me what to do." Clara put her to work. Martha was not a trained nurse, but she was steady, and she was willing, and she followed instructions without argument. She worked through the night and returned the following evening and the evening after that, slipping out of the parsonage after Pruitt fell asleep carrying whatever supplies she could gather. When Pruitt discovered what his wife was doing, he confronted her in the church vestibule. Clara heard about it afterward from Martha herself, who told the story with the flat, even tone of a woman who had made a decision and intended to stand by it. "He told me I was defying God's will," Martha said. "I told him those men are saving lives while he preaches about sin. I asked him which side he thought God was on. He did not have an answer for that. He has not spoken to me since." On the 12th day of the epidemic, Clara was changing bedding on the second floor of the saloon when she heard something that stopped her cold. A cough, not the wet, productive cough of cholera, a dry, hacking cough that came from the direction of the stairwell. She walked to the top of the stairs and looked down. Vance was standing at the bottom, one hand braced against the wall, the other pressed to his mouth. He coughed again, his body folded at the waist, and then his knees buckled, and he started to fall. Roth caught him. He appeared from somewhere to the left, moving fast, his arms going around Vance's chest from behind, taking his weight, lowering him to the floor, with the controlled precision of a man who has been trained to handle falling bodies. Clara came down the stairs 3 at a time. By the time she reached the bottom, August was already there, his fingers on Vance's wrist, reading his pulse. Vance was conscious, but sweating. His skin was pale and clammy. His eyes, those Winter Creek eyes that had never shown weakness, were glazed with the particular dullness that Clara had seen in 30 patients over the past 12 days. "He is infected," August said. "Not severely. His constitution is strong, but he needs to rest." "I am fine," Vance said, and tried to stand. He made it halfway before his legs gave out again. Roth caught him again. "You are not fine," Roth said. "For once in your life, listen to someone else." They carried him upstairs to one of the isolation rooms. Clara prepared a cot while August mixed a treatment compound, his hands moving with a speed and certainty that suggested he had been preparing for this possibility for days. Perhaps he had. August had a way of seeing things before they arrived. Clara sat with Vance through the first night. August's compound was working, bringing down the fever, controlling the symptoms, but Vance was restless. He moved in and out of consciousness, his body fighting the infection with the same stubborn, methodical determination that characterized everything he did. In the deep hours of the night between 2 and 4 in the morning, when the fever was at its worst and the boundary between consciousness and delirium was at its thinnest, Vance began to talk. "Daniel," he said. His voice was cracked and dry. "Daniel, I am here. Do not be afraid. Father is here." Clara looked at August, who was sitting in the corner, preparing a fresh dose of compound. August's hands did not stop moving, but his voice when it came was quieter than usual. His son August said, Daniel died when he was 5 years old. There was a fire in 1866. Their home. Vance was inside when it started. He carried his wife out, but when he went back for the boy, the roof collapsed. He found Daniel in the back room. The boy was still alive when Vance reached him. He died in Vance's arms before Vance could carry him out. Clara looked at the man on the cot, at the sweat on his forehead and the restless movement of his hands reaching for something, reaching for someone who was not there and had not been there for 7 years. That is why he cannot lose patience, she said. Not a question. August nodded. Every patient who dies is Daniel again. Every child especially. When Tommy Dawson was on the table, Vance saw his son. He has never told me this. He did not need to. Clara understood now. The fear she had seen in Vance's eyes during Tommy's surgery. The way his hands had trembled. Not because he doubted his skill, because the boy on the table was the same age as the boy he had lost, and some part of Nathaniel Vance, the part that was not surgeon but father, was reliving the worst moment of his life with every passing second. She took a cloth wetted in cool water and pressed it to Vance's forehead. His hand found hers and gripped it. He did not know who she was in that moment. He thought she was someone else. He called her Sarah, his wife's name. Clara held his hand and let him think she was Sarah and did not correct him. Some lies are kinder than truth. There was a locked wooden box she had found weeks ago in the storage room, hidden behind crates of bandages. The initials NV carved into the lid and the words Field Hospital Gettysburg, 1863. She had not opened it. She had not asked about it. But later, much later, when Vance was recovered and the epidemic was behind them, he would unlock that box and show her what was inside. A small daguerreotype photograph of a young woman and a boy, both smiling, and a piece of fabric burned black at the edges that had once been part of a child's nightshirt. Everything that was left, but that was later. Now in the small hours of the morning, Clara held the hand of a man she was only beginning to understand, and she made him a promise she was not sure she could keep. You will not die, she said. I will not allow it. For 3 days, Vance was down. And for those 3 days, Clara Roth and August ran the practice in the epidemic response without him. Roth handled the surgical cases. August managed the pharmacy. And Clara did what Vance had been doing. She made the decisions. Triage. The word comes from the French, meaning to sort, to separate the wounded into categories. Those who will survive without treatment, those who will survive with treatment, and those who will not survive regardless. It is the hardest skill in medicine, harder than any surgery, harder than any diagnosis, because it requires you to look at a human being and make a calculation about the value of spending time on them versus spending time on someone else. Clara made that calculation 17 times in 3 days. The hardest was on the second night. An old man 70 years old, a retired miner named Silas Burke, and 2 children, a brother and sister, 8 and 6. All 3 critically dehydrated, all 3 fading, and August's rehydration compound was running low. Not enough for 3, enough for 2 maybe if she acted now. Clara looked at Silas Burke. She looked at the children. She made the decision in 4 seconds. It felt like 4 hours. She treated the children. Silas Burke died at 3:14 in the morning, alone in a cot at the far end of the saloon. Clara found him when she made her rounds. His eyes were open. His face was peaceful. He looked like a man who had simply decided to stop. She closed his eyes. She pulled the sheet over his face. She walked to the back door of the saloon and stepped out into the warm August night and stood in the alley behind the building and cried. Not loudly, not dramatically, just tears running down a face that was too tired to hold them back anymore, falling onto a dress that was stained with things she no longer tried to identify. August found her. She heard him this time. His boots on the wooden step, deliberate, unhurried. He wanted her to know he was coming. He sat down beside her. Their shoulders touched. He did not put his arm around her. He did not offer comfort. He just sat there present, solid, a point of warmth in the darkness. After 5 minutes of silence, he said, "You saved 2 children tonight, and I let an old man die." "You chose," August said. "That is the hardest lesson in medicine. Not how to save people, how to decide who gets saved." Clara wiped her face with the back of her hand. It came away wet. Is it always this hard? Yes, every time. If it ever stops being hard, you should quit. They sat in silence for a while longer. The stars were out thick and bright in the Wyoming sky, more stars than Clara had ever seen in St. Louis. The air smelled of smoke from the burn pile and carbolic from the saloon, and something else, something clean and cold, blowing down from the mountains to the north. She breathed it in and let it steady her. Tomorrow will be worse, August said. I know. And the day after that. I know that too. He looked at her. In the starlight, his dark eyes were luminous. You are becoming the person Vance saw when he read your letter, he said. The person he saw before you saw yourself. Clara looked at him. What person is that? A physician. Not a nurse, not an assistant, a physician. She did not argue. 2 months ago, she would have. 2 months ago, she would have said that was impossible, that the medical establishment would never recognize a woman, that the law would not permit it, that society would not accept it. But 2 months ago, she had not held a dying boy's hand while his heart stopped. She had not ligated a severed artery while standing between three men who had taught her that the body was not a mystery, but a machine. She had not sat in the dark beside a man whose silence said more than most people's speeches. 2 months ago, she had been a different person. That person was gone. The epidemic peaked on the 18th day and broke on the 22nd. The cases slowed. The water supply was identified and shut off. Clean water was brought in from a spring 2 miles east of town. People stopped dying. The final count was 11 dead. It should have been higher. Everyone knew it should have been higher, and everyone knew why it was not. Vance recovered. He was on his feet by the fourth day, thinner and paler, and moving more slowly than before, but upright. Functional. His eyes had the particular sharpness of a man who has been reminded of his own mortality and has decided to take the reminder personally. Even Dawson's ranch hands had been saved. 2 of them, brought to the saloon by their foreman against Dawson's explicit orders, had been treated by Clara and August and had walked out alive. They did not thank anyone publicly. They did not need to. Everyone in Redemption knew who had saved them. For a brief, fragile moment, it seemed like the worst was over. It was not. Marshal William Cole arrived in Redemption on a Tuesday morning in early September, 3 weeks after the epidemic ended. He rode in on a bay horse with a U.S. Marshal's badge on his chest and a leather satchel full of paperwork, and the expression of a man who took his job seriously and wished other people would stop making it complicated. Cole was 50 years old, lean, deliberate, the kind of lawman who gathered facts before forming opinions and formed opinions before taking action. He did not raise his voice. He did not make threats. He asked questions, listened to the answers, wrote things down in a small notebook, and kept his own counsel. He had been sent to investigate 2 complaints. The first was Henry Dawson's formal accusation of negligence in the death of his son Tommy. The second was an anonymous letter alleging that an unlicensed woman was performing surgical procedures at Vance Medical. Cole set up in the back room of the general store and began interviewing the citizens of Redemption one by one. Clara watched the procession from the window of Vance Medical. Ranch hands, shopkeepers, the bartender from the Brass Spur, Martha Pruitt, who walked into the general store with her head high and her jaw set and did not come out for 45 minutes. Vance was calm. He had prepared for this. The patient records were immaculate. The inventory ledger was complete. Every procedure was documented, every compound cataloged, every decision recorded in Vance's sharp, angular handwriting. On paper, Clara was a surgical nurse who assisted under direct supervision, always under direct supervision. It was only partly a why. But while Cole was asking questions about medical practices, Dawson was escalating. It started with the laboratory. Clara came downstairs one morning to find the door to August's workroom hanging from one hinge, the interior destroyed. Glass bottles shattered on the floor. Compounds spilled and mixed, creating pools of color that bled into each other like wounds. The leather-bound notebook where August recorded his formulas, 3 years of research and experimentation, and inherited knowledge had been torn apart, the pages scattered across the room like leaves after a storm. August stood in the middle of the wreckage. He was perfectly still. His face was blank. His hands, those steady hands that could measure a dose to the 10th of a grain, were trembling. Clara stepped over the broken glass and stood beside him. She did not touch him. She did not speak. She simply stood there, the way he had stood beside her in the alley behind the saloon offering presents instead of words. After a long time, August said, "They took 3 years from me." His voice was flat, controlled. But the control was the kind that comes from holding something back, not from having nothing to hold. "We will rebuild it," Clara said. He looked at her. What she saw in his eyes was not anger, it was exhaustion. The bone-deep weariness of a man who had been rebuilding things his entire life and was running out of material. 2 days later, Harwell announced publicly that August Compounds had contributed to Tommy Dawson's death. He said it in the general store loudly enough for a dozen people to hear. Exotic herbs, he called them. Unregulated substances of unknown composition administered to a 14-year-old boy by a man whose training, if it can be called that, took place in institutions that no reputable physician would recognize. The night after that, two of Dawson's ranch hands caught August on the street after dark. The beating was quick and efficient, the work of men who had been told what to do and how far to go. Not far enough to cause permanent damage, far enough to send a message. When Clara cleaned the cuts on August's face and wrapped his bruised ribs, she saw the old scars on his back. Long parallel lines healed white against his darker skin. She knew what they were. She did not ask about them. He did not offer. But later that night, sitting in the destroyed laboratory with his back against the wall and his ribs aching and his hands finally steady again, August told her the rest of his story. "My mother was the best healer I have ever known," he said. "Better than Vance. Better than anyone trained in Paris or London or anywhere else. She could look at a person and see what was wrong with them, the way other people see the color of someone's eyes. It was in her. It was always in her." He paused. "When I came back from Paris, I tried to bring both worlds together, her knowledge and theirs. It worked. My patients healed faster. They had less pain, fewer infections. And then a rich white man died in my clinic, not from anything I did, from a heart that had been failing for years. And suddenly everything I had built was evidence of witchcraft." His voice did not change. It remained flat and factual, the voice of a man recounting a medical case rather than the destruction of his life. "They said I poisoned him. They printed it in the newspaper. My mother got me out of the city on a boat to Galveston at 3 in the morning. I have not heard from her since. I do not know if she is alive." Clara took his hand. She held it the way she had held Tommy Dawson's hand in the hours before he died, the way she had held Vance's hand during his fever. Not as a lover, as a human being who understood what it meant to lose everything and keep going. "You are here," she said. "No one is driving you anywhere." August looked at their joined hands. He did not pull away. "Not yet," he said. Cole finished his investigation on a Friday afternoon. He asked to meet with Vance privately in the office at Vance Medical. Clara stood in the hallway outside the closed door and listened to the low murmur of voices, unable to make out the words, but able to read the rhythm of the conversation, the pauses that indicated questions, the longer stretches that indicated answers. When the door opened, Cole stepped out. He looked at Clara. He studied her for a moment with the careful, non-committal expression of a man who sees more than he says. "Mrs. Vance," he said, "I received an anonymous letter stating that you have been performing surgical procedures without a medical license. Is that true?" Clara met his gaze. She thought about the tooth she had extracted, the abscesses she had lanced, the wounds she had sutured, the arterial ligation she had performed on a cadaver with Roth's hand covering hers and Vance's voice in her ear. She thought about the decisions she had made during the epidemic, the triage calculations, the moments when she had acted not as a nurse following orders, but as a physician making judgments about life and death. "I assist under direct supervision," she said. "Always." It was a half-truth. Cole looked at her the way a man looks at a card he suspects is marked. Then he nodded once and put his notebook away. His official conclusion was delivered to Vance the following morning. Insufficient evidence to close the practice. The death of Tommy Dawson was consistent with peritonitis resulting from a ruptured appendix, a complication that carried a high mortality rate regardless of treatment. No evidence of negligence or malpractice. However, Cole added, and this was the part that mattered, "I will return in 6 months for a follow-up inspection. I suggest you ensure that everything here remains strictly within the bounds of territorial law." He rode out of redemption that afternoon. Clara watched him go from the window of Vance Medical and felt something loosen in her chest that had been tight for weeks. But the loosening lasted exactly 2 hours. Because that evening, August came into the examination room with his face set in the expression Clara had learned to recognize as the one that preceded bad news. Harwell filed a formal complaint with the medical board in Cheyenne, August said, separate from Dawson's complaint. Professional misconduct, specifically targeting me. He is claiming that my compounds are unregulated and potentially toxic, and that I am practicing under fraudulent credentials. He paused. If the medical board investigates and rules against me, I lose my license. And if I lose my license, the practice loses its pharmacist, which means Vance Medical cannot function. Her eyes went to Vance. He was sitting at his desk, his hands flat on the surface, his expression completely terrifyingly calm. Then we make sure the medical board has no grounds, Vance said. August, rebuild your formulary. Document everything, every compound, every ingredient, every dosage. Clara, help him. Roth, I need you to write to every colleague we have east of the Mississippi and request character references. We have until spring. The winter came early that year. By the first week of November, snow had sealed the passes and the temperature had dropped in below zero, and redemption was cut off from the outside world, completely as if it had been relocated to the surface of the moon. No stagecoach, no mail, no supply wagons, just cold and silence, and the particular brand of isolation that comes from being surrounded by mountains that do not care whether you live or die. Clara and August spent every evening rebuilding his pharmacopoeia. She measured while he mixed. She recorded while he tested. She learned the properties of plants she had never heard of. Remedies passed down through generations of healers whose names had been forgotten by the same history that would forget theirs. It was painstaking work, slow and precise, and it required the kind of sustained attention that left her mentally exhausted by the end of each session. But it also brought her closer to August than she had been to anyone. Working side by side in the small laboratory, their hands sometimes touching over the mortar and pestle, their voices low in the quiet of the winter evening. He told her about Paris, about the Seine in autumn, about the professor who had said to him, "You have the hands of a surgeon and the mind of an herbalist, and I do not know if that is a compliment or a warning." She told him about her mother, about the long months of watching someone you loved dissolve into sickness, about the silence of the house after her mother died, a silence so complete it felt like a physical substance, something you could reach out and touch. They did not discuss what they were to each other. They did not need to. What they were was visible in the way they worked together, in the synchrony of their movements, in the easy, unspoken communication that develops between people who have shared enough difficulty to stop performing and start simply being. On a night in late November when the temperature outside was 20 below and the wind was screaming across the flats like a living thing, the front door of Vance Medical was struck by a fist. Not knocked, struck. The sound was desperate and rhythmic, the sound of someone hitting a door, not to request entry, but to demand it. Clara was closest. She opened the door. Henry Dawson stood on the porch. He was coated in snow. His horse was behind him, heaving, steaming its flanks, white with frost. Dawson's face was a color Clara had never seen on a living person, somewhere between gray and blue, and his eyes were the eyes of a man who has been stripped of everything. Pride, anger, hatred, and reduced to the single primal need to save someone he loves. "My wife," he said. His voice broke on the word. "Margaret. She is in labor. 7 months. The baby is breech. There is blood. A lot of blood. The midwife does not know what to do." He stopped. He swallowed. What came next cost him more than anything he had ever said in his life. Clara could see it in the way his throat worked, the way his hands shook, the way his entire body seemed to compress under the weight of the words. "Save her. Please, save my wife." The silence lasted exactly 2 seconds. Then Vance was behind Clara, already moving. "Elias Field surgical kit. August, everything you have. Clara, you are with me." The ride to the Dawson Ranch took 40 minutes through a blizzard that reduced visibility to approximately 10 feet. 5 miles on horseback in the dark, in wind that cut through clothing like a blade and drove snow into every exposed surface of skin. Clara rode behind Roth, her arms locked around his waist, her face pressed against his back. She had never been on a horse before arriving in Wyoming. She was terrified. She did not say so. The ranch house was large, well-built, warm. But the bedroom where Margaret Dawson lay was a scene from a nightmare. Blood on the sheets, blood on the floor. Margaret, 32 years old, dark-haired, small-boned, was unconscious. Her skin, the color of candle wax. Her breathing so shallow it was almost invisible. The midwife, a heavy-set woman named Ruth, stood in the corner with bloody hands and an expression of total helplessness. Vance examined Margaret. His hands moved across her swollen abdomen with the same gentle precision he brought to every examination. The granite held. But Clara had learned to read the micro-expressions that live beneath the granite, and what she saw, there was a calculation being performed at very high speed. Breech presentation, Vance said. Placental abruption. She is hemorrhaging. Natural delivery is not possible. We need a cesarean section. The room went quiet. Everyone in that room understood what a cesarean section meant in 1873. It meant opening a woman's abdomen on a kitchen table with oil lamps for light and ether for anesthesia and a mortality rate that made strong men look away. Then Vance said the thing that no one expected. Clara, you are primary surgeon. The silence that followed was not quiet. It was deafening. Roth looked at Vance. August looked at Vance. Clara looked at Vance. Dawson, who had been standing in the doorway, stepped forward. Her, the nurse, you are going to let her cut open my wife. Vance turned to face him, and the look he gave Henry Dawson was the coldest thing Clara had ever seen one human being direct at another. My hands have been operating for 14 hours today. They are not steady enough. Elias has been splinting fractures since dawn, and his grip is compromised. August needs to manage the anesthesia and the hemorrhage control, which requires his full concentration. Clara has the steadiest hands in this room right now. She has practiced this procedure on cadavers 3 times, and she will be operating under my direct verbal guidance with Elias assisting and August managing the pharmacology. He paused. Do you want your wife to live? Then sit down, be quiet, and let us work. Dawson sat down. He did not say another word for the next 90 minutes. They cleared the kitchen table, covered it with clean sheets, positioned the lamps. August administered the ether. His hands steady, his face focused, his breathing controlled. Ross stood at Clara's right side, instruments arranged, sutures, threaded clamps ready. Vance stood behind her close enough that his voice would reach her without having to rise above the sound of the wind outside. Clara looked down at Margaret Dawson's swollen belly. She thought about Tommy, about the boy who had died on their operating table because his father had waited 3 days to bring him in, about the father who had stood in their examination room and said, "You killed my son," about the months of threats and sabotage and social isolation that had followed. And now that same father was sitting in the corner of this kitchen, asking her to save his wife. She picked up the scalpel. Vance's voice came from behind her, quiet, steady, each word weighted with the precision of a man who understood that his voice was the only instrument he could wield tonight. Midline incision. Begin at the umbilicus, carry it down to the pubic symphysis. Clara cut. The blade parted the skin cleanly, a thin red line that widened as the tissues separated. Blood welled up immediately. August was there with gauze applying pressure, controlling the flow. Deeper, Vance said. Through the subcutaneous fat. Through the fascia. She went deeper. Layer by layer, the way she had been taught, the way she had practiced on cadavers in the surgical suite, with Roth's hand on her wrist and August's voice naming the structures and Vance's presence behind her like a wall she could lean against. Through the rectus muscles. Careful with the peritoneum. It is thin. She found the peritoneum, opened it. The uterus was there, swollen, blue-red, enormous. She could see the baby through the uterine wall, a dark shape pressed against the stretched tissue. Incision in the lower uterine segment. Small. Controlled. You do not want to cut the baby. Clara made the incision. The uterine wall parted. Amniotic fluid gushed out, warm, clear, mixed with blood. She reached in. The baby was small. Too small. 7 months. A girl. She was blue and still, and her eyes were closed, and she did not move when Clara's hands closed around her. Clara lifted her out. August cut the cord. Roth took the baby. He cradled her in one large hand, her entire body fitting in his palm, and he rubbed her back with his thumb, firm, rhythmic. Silence. Nothing. Silence. And then a sound. Thin, wavering, barely there. Like a thread of sound pulled from the air by sheer force of will. A cry, weak but present, alive. Roth looked up. His eyes were wet. Clara had never seen Roth cry. She filed it away in the part of her mind that was still capable of thought and turned back to Margaret. Close the uterus, Vance said. 2 layers, running suture, control the bleeding at the placental site. Clara closed the uterus. She closed the fascia. She closed the skin. Her hands were steady throughout. She did not hold her breath. She did not hesitate. She did not wait for permission. When the last suture was tied, she stepped back from the table and looked at Margaret Dawson. Alive, breathing, color returning. And across the room in Roth's arms, a baby girl was making the small, angry sounds of a creature that had been forced into the world before she was ready and intended to voice her complaints about it. Clara looked at Dawson. He was crying. She had never seen Henry Dawson cry. She had seen him angry. She had seen him cold. She had seen him calculating. But she had never seen him cry, and the sight of it, this large, powerful, stubborn man, with tears running into his beard and his hands shaking in his lap, was more devastating than anything she had witnessed during the cholera epidemic. "You saved her," Dawson said. His voice was destroyed, barely recognizable. "You saved my wife." Clara looked at him. Her hands were covered in his wife's blood. Her dress was ruined. Her hair was coming down from its pins. She was exhausted in a way that went beyond physical fatigue, that reached into the marrow of her bones and the bottom of her soul. "That is my job," she said. The ride back to redemption was quiet. The blizzard had eased to a steady snowfall. Clara rode behind Roth again, but this time she was not afraid. She was too tired for fear. She leaned against his back and closed her eyes and listened to the steady rhythm of the horse's hooves in the snow. Behind her, Vance rode alone. She could not see his face in the dark, but she could feel his presence the way she always could, solid and immovable, a fixed point in a world that would not stop moving. August rode beside Vance, and just once, Clara heard Vance say something to him in a voice too low to make out the words. August's reply was a single syllable that might have been yes, or might have been something else entirely. They arrived home at 3 in the morning. They did not speak. They did not need to. They climbed the stairs together. 4 people who had walked through fire and come out the other side, and they went to their rooms and slept the sleep of people who have done something difficult and necessary and right. What followed happened slowly, the way seasons change, not in a single dramatic moment, but in the accumulation of small shifts that gradually alter the landscape. Dawson withdrew his complaints. All of them. He paid for the reconstruction of August's laboratory out of his own pocket. He did not apologize in words. Men like Henry Dawson do not apologize in words. But every week, a wooden crate appeared at the back door of Vance Medical, containing beef butter and vegetables from the Dawson Ranch. And every week, Clara brought the empty crate back to the ranch and collected a full one, and the transaction was conducted in the particular silence that serves as currency in places where pride makes speech impossible. Dawson named his daughter Clara. Pruitt lost his congregation's attention. Not dramatically, not all at once, but Martha's public declaration that August had treated her when no other physician would, that he had helped her with a condition her own husband did not know about, and no doctor in Cheyenne had been willing to address, shifted something in the town's perception. Pruitt still preached. Fewer people listened. The pews were a little emptier each Sunday. The collection plate a little lighter. Harwell left Redemption in December. His practice had no patience. He packed his leather bum and his black suit and boarded the last stagecoach before the winter snows closed the passes. On his way out, he stopped at Vance Medical. He looked at Vance and said, "You are violating every rule of medical practice." Vance said, "I am saving lives. That is the only rule I follow." Harwell left. He did not come back. On a quiet evening in late December, after the last patient had gone and the instruments had been cleaned and the ledger had been updated, the 4 of them sat together in the room upstairs. Vance in the chair by the window, Roth on the edge of the bed, August leaning against the wall, Clara in the center, cross-legged on the rug, her back straight, her hands in her lap. The lamp was turned low. The wind pressed against the windows with the patient insistence of something that has been trying to get in for a very long time. The room smelled of wood smoke from the stove downstairs and carbolic from the examination room, and something else, something warm and human and alive. No one spoke for a long time. The silence was not empty. It was full of everything they had survived together. The cholera, the investigation, the threats, the beating, The night in the blizzard, the baby girl who had been born in a kitchen while the world tried to tear itself apart outside. Clara reached out. She took Vance's hand with her left, Roth's hand with her right. Under the table, her foot pressed against August's boot. 3 points of contact. 3 men. One woman who had come to Wyoming as a mail-order bride and had become something else entirely. Vance looked at her. In the low lamplight, his granite face was softer than she had ever seen it. The lines around his eyes were still there. The grief was still there. But there was something else now, something that had not been there 8 months ago. "You have changed," he said. Clara shook her head. "No, I have become who I always was. There was just no one in St. Louis who would let me." A letter arrived from Cheyenne in the spring thaw. The medical board was sending a formal inspection team. Not because of Dawson's complaints, which had been withdrawn, not because of Harwell's allegations, which had been dismissed, because the reputation of Vance Medical had spread across the territory, and the board wanted to know what the best surgical practice west of the Mississippi was doing. Vance read the letter and set it down. This could be an opportunity, or it could be a problem. Clara picked up the letter and read it herself. "We survived cholera," she said. "We survived a blizzard. We survived Henry Dawson. An inspection committee is not going to be what breaks us." Vance looked at her. The corner of his mouth moved. That thing that was not quite a smile but lived in the same neighborhood. After 8 months, Clara had learned to read it fluently. The practice in redemption continued for another decade. Vance, Roth, August, and Clara became known throughout the Wyoming Territory and beyond as the finest surgical team west of the Mississippi River. They trained other physicians. They published papers. They saved lives that would have been lost anywhere else. Baby Clara Dawson grew up healthy and strong. Every year on her birthday, Henry Dawson brought her to Vance Medical for a checkup. The big Clara would listen to the little Clara's heart with a stethoscope and pronounce her perfect, and Dawson would stand in the doorway with wet eyes and say nothing, and the saying of nothing was louder than any apology he could have spoken. Years later, when Clara looked back on her time in redemption, she did not remember it as a scandal or a transgression. She remembered it as the most honest education she had ever received. 3 mountain men had taught her that medicine was not just about knowing anatomy. It was about understanding the full complexity of what it meant to be human. That the body was not something to be ashamed of. That boundaries drawn by society could be redrawn by people brave enough to hold the pen. And the most radical thing a woman could do in 1873 was not to demand equality. It was simply to take it without permission, without apology, without waiting for the world to catch up. Let me ask you something. When was the last time you chose to learn something that everyone told you that you should not? When was the last time you trusted someone the world told you not to trust? When was the last time you stood in a room full of doubt and chose to believe in yourself anyway? If this story meant something to you, hit that like button. Share it with someone who needs to hear it. Subscribe if you want more stories like this. Stories about people who took risks and learned in unconventional ways and discovered that the most important lessons are the ones taught through experience rather than textbooks. And tell me in the comments, where are you watching from right now? What time is it where you are? I read every comment, every single one. Because here's the truth that Clara Whitmore learned in a whitewashed building at the end of Main Street in a town called Redemption. The most important anatomy lesson is not about bones or muscles or the path of a nerve through living tissue. It is about trust, about honesty, about the courage to be seen completely and not look away. That is the anatomy that matters. That is the lesson that stays. Clara Whitmore asked, and she was answered. Not with permission, but with partnership. And that made all the difference, because sometimes the bravest thing you can do is not to fight. It is not to run. It is to stand still in a room full of people who see exactly who you are and to say simply and without apology, "This is me. Teach me. Let me learn." And if you are lucky, if you are very lucky, the answer will not be a door closing. It will be a door opening into a room you did not know existed, full of people you did not know you needed, teaching you things you did not know you were ready to learn. That is what happened in Redemption, Wyoming in the year 1873. That is what happened to a virgin bride and 3 mountain men who built something the world said could not exist. And it is never too late to build something like that yourself. I will see you in the next story.